Guess what, everybody? It's time to sign up for Medicare or your employee insurance plan again. So we want to make sure you know what to do before you do so. And guess what? Our next guest is the man behind Blue Cross Blue Shield Straight Talk blog, and he is here with some tips. Please help me welcome back economist Mike Berteau. Welcome back, Mike.
Thanks so much, Malik. What a great day to be here with you.
Yes, it is. The first time, honestly, in studio in, what, 2 years that I've interviewed you. Yes. And I'm always talking to you every year about Medicare enrollment, employee insurance, and I want to ask you why now is the time to really start thinking about these things.
Well, we've got kind of a triple witching hour going on here because we're in a Medicare annual enrollment period that allows people to switch plans freely back and forth. That'll run until December 7th. Okay. For people who don't get a good offer of coverage from an employer, they'll be able to buy on healthcare.gov here in Louisiana with the largest tax credits we've ever seen available for folks, all the way to December 15th, if you want a plan that starts on January 1st, or until January 15th when the open enrollment period closes. At the same time, at least a third of the employers in Louisiana are offering coverage to their employees to pick right now.
Absolutely, like ours. I already signed up for mine. I can't believe it. I'm like, my goodness, it's not even December yet, but I've already signed up for 2023. And you know, for the families out there, there's actually something new in regards to healthcare insurance. Talk to me about the family glitch fix.
Yeah, I'm excited to report the fact that families who were in employer coverage before and found it to be very unaffordable for the dependents and the spouses of the employee now have a clear path to affordable coverage they've never had before.
Woohoo!
Yes, they can go to healthcare.gov, bring their employer's offer with them, have it tested. If healthcare.gov says it's unaffordable, then they can shop on healthcare.gov and draw tax credits to help them pay for premiums that they could never get before. It's all brand new.
Is that what making healthcare insurance more affordable? Because I was reading that now more people are qualifying for financial assistance when it comes to healthcare coverage, which is good. How did that happen, and how do people know if they qualify for more affordable healthcare insurance?
Well, you know your employer is going to give you an offer, right? And he's going to have a rate for the employee and a separate rate for the family, dependents, spouses. You can take all of those rates to healthcare.gov, and they have a worksheet, and you can just populate it with the offer you got from your employer. And the website will tell you that's affordable, take it, or it'll say that's not affordable, continue and shop on healthcare.gov, and based on your income, you could get tax credits, you could qualify for Medicaid, a lot of really good things could happen from that point forward.
So I want to ask you this, right, because I recently re-signed up for healthcare insurance myself, and honestly, all of it is like auto-filled. You know, you just kind of check a couple of boxes. If you had it last year, you kind of just maybe double check and say, sure, I'm good with that plan. What should we really be looking at when it comes to healthcare coverage that maybe we're not looking at because it is all automated at this point?
Honestly, no matter what level you're buying, whether it's Medicare, employer coverage, or individual coverage, you have got to stick to the 3 Ps, right? Number 1, provider. Make absolutely sure the doctor you want to see and the hospital you want to use
is
are
in
covered by that health plan.
I agree. It happened to me. I messed up on that P for sure.
You're not the only one. Okay?
Thank God.
But we need to let people know, don't settle for a plan that doesn't cover your doc and your hospital. Second, a lot of us are already on prescription drugs. You got to make sure your plan's going to cover the drugs you're already on and that you're going to be able to afford the copay on the drug you're on. And the third thing, some plans now, especially for seniors, come with amazing perks, like low prices for health club memberships or gift cards to help you buy supplies that you need to help improve your health. Always want to keep an eye out for those.
The 3 Ps, write that down, everybody. So great. And you know, for people who are signing up for Medicare for the first time, you all are doing Medicare Made Easy the Wednesday, I believe, before Thanksgiving. Tell us about what that workshop looks like.
Yes, occasionally, once a month, this time of year, we do an online presentation that's designed to help seniors figure out exactly how to buy their Medicare plan. The next one will be Wednesday right after Thanksgiving.
After Thanksgiving.
Yes, and we'll have people online. It'll be a Facebook Live event. It'll be streamed on other websites as well. We'll put the ads out there, and afterwards, we'll put the recorded video on our YouTube channel.
And that's for 65-year-old plus?
Yes, 65 plus on the Medicare
Come
part.
on, 60 plus, everybody. Well, look, Mike, thank you so much for the information, the 3 Ps, everybody. And look, for more information about this topic, about Medicare, the enrollment plan, so much more, you can log on to getplanoptions.com or call 1-844-GET-BLUE. And for more information about his blog, Straight Talk, head over to straighttalkla.com. All right.